Hi friends, I'm Dr. Balakumari. Now we will see about what is the problem if the amniotic fluid leaks before labor pain starts. This we call it as pre-labor rupture of membranes or premature rupture of membranes. If it happens preterm, we call it preterm rupture of membranes. So what is this water bag around the baby? It's actually called amniotic fluid. This fluid is contained in a sac. The covering of the sac is called the amniotic membrane. This is the first structure to start in a pregnancy. Around 5 weeks of pregnancy, we call it as a gestational sac, and then later it is called as amniotic membrane. This is the sac in which the baby grows. The baby needs space to move, to breathe, to play around, and that is given by this gestational sac or amniotic sac. Amniotic membranes ruptures usually nature has created in such a way because this is so vital for the movements of the baby, for the growth of the baby, lung maturity of the baby. This is very, very essential. This membrane ruptures naturally when the baby is ready to be delivered. The labor pain has started, the uterine mouth is fully open, the head has come down, ready for delivery. Then the membrane ruptures. Okay, till then it holds on. For a very few people, the membranes can rupture or leak much earlier than expected. It can be any time during pregnancy. It can be 5th, 6th, 7th or 8th month. What will happen if the membranes rupture and the fluid leaks? It depends upon the time at which the membranes rupture. What are the effects of the membrane rupturing? Whenever there is a leak, what will happen? The fluid will leak and there will be less fluid around the baby. The baby will not be moved, will not be able to stretch itself. It actually gives a protective cover for the baby, and once it opens up, what will happen? The bacteria from the vagina of the mother invades into the baby's environment and produces infection. The initial infection of the membranes is called chorioamnionitis. This will lead next to what is called as an adherent placenta. The placenta is the structure which gives nutrition to the baby, and that has to be expelled once the baby is delivered. When there is an infection, what will happen? Placenta gets adherent, doesn't get delivered after the birth of the baby. In those situations, there will be excessive bleeding. So these two concerns, infection and bleeding, are very, very dangerous for the mother as well. The inability to move, restriction of the movements will affect the growth of the baby, the growth of the lungs and the limbs. So it is very important that the fluid remains in correct quantity till delivery. Now let's see what happens if the membranes rupture at different times of pregnancy. The pregnancy duration is 40 weeks. When the membranes rupture after 37 weeks, the baby is fully mature. We call it term pregnancy or a full term pregnancy. After 37 weeks, if it ruptures, we are not worried about the maturity because baby is already mature. So we are not worried about the growth of the baby. Now the problem is only infection and bleeding. So to prevent infection and bleeding, we have to deliver early in a day or two. Supposing the membranes rupture between 32 to 36 weeks. Now the difficulties of infection and bleeding are there. Apart from that, now comes the question of maturity. This baby is partially mature. The lung maturity is not full. Otherwise, this is a baby which can be managed reasonably well when it comes out. In these situations, we give an injection called steroid injection to the mother, which will enhance the lung maturity. Whenever we say steroids, the patients really panic. Madam, steroid injection. Why do you give steroid injection during pregnancy? Remember, steroid is a life-saving drug. Only when used inappropriately, it is dangerous. In this situation, it is a life-saving drug for the baby. It is usually given for 2 days. The lung maturity of the baby becomes better. The breathing problems after delivery will be less. And the steroids will take 1 or 2 days to act. So after the steroid injection, we deliver after 2 to 3 days. If it is somewhere around 32 weeks, we would prefer to wait for a week or two. But if it is after 34 weeks, after 1 or 2 days, we would prefer to deliver the baby. The next group of patients, when the leakage occurs between 28 to 31 weeks, this is an extremely premature baby. This will have lots of issues of prematurity. Will not be able to breathe, will not be able to take feeds, will not be able to keep the warm warmth, will not be able to maintain the sugar levels after birth. So these are the difficulties of extreme preterm babies that are born between 28 to 31 weeks. Along with this, we have the problems of infection and bleeding for the mother and the baby. So in this situation, the problems of prematurity are more, so we try to wait as many days as possible. Instead of delivering too early, if there is no infection, we generally wait longer in this category of patients. Sometimes it may be 1 or 2 weeks or even 1 month, provided there is no other problem. In any of this category, whenever the mother has fever or bleeding, or if the discharge that is coming out of the vagina has a bad odor, means the infection is severe, then we have to deliver. Whatever the situation is, we have to deliver. Between 24 to 28 weeks, it is a real dilemma. Now there is a possibility to save the baby, but it's going to be extremely difficult and very expensive as well, but there is a lot of risk to the mother. So in these situations, we usually sit and talk to the mother, assess individually. All the cases actually have to be assessed individually, particularly in this group of patients. Assess individually, and then we have to decide whether we have to wait or deliver. If the waters break before 24 weeks, it is usually very difficult to save the baby, and even if the baby is saved, there will be a lot of problems for the baby. So most of the times we have to take a decision to deliver, and we will always discuss with the mother and the pediatrician, and we will always try and save the baby, but sometimes it may be difficult. So now you know all the difficulties of having a rupture of membranes before the labor pain starts. We call it PROM, premature rupture of membranes. How to identify this premature rupture of membranes? Many people mistake it for frequency of urination. Remember, if it is frequent urination, even if a drop of urine is to be passed, you get the sensation to pass urine. If it is rupture of amniotic membrane and leakage of the amniotic fluid, you will not have the sensation to pass urine, but your dress will be wet. Sometimes suddenly you find the bed where you are lying down is wet. So whenever you have a doubt whether the membranes are leaking, please go to your obstetrician and verify. Wish you all a very safe motherhood. Thank you.